what does Pelvic Sense do that's different than anything else? Well, Pelvic Sense is going to do something called reverse the central sensitization, which means it's going to change the way that your nervous system and brain has learned a protective way to protect you, but it's really very faulty. So let me explain, what does that mean? So after about 3 or 4 months, if anybody is experiencing or feeling distress, discomfort, or pain, the nervous system wants to do a great job along with the immune system. Their job is to zoom up information to the brain, tell the brain, hey, there's a threat. And the brain in turn discovers or thinks about, is it really a threat? And if it feels like it is, it will send signals of distress. But a lot of people, in terms of their threat, it could be a social threat. You weren't invited to a party. Or a psychological threat. You had a fight with your husband. Or you're not making enough money this month to pay your bills. These are all considered threat. And the longer one has been in a discomfort or pain syndrome, what happens is that the nervous system and the immune system become like Wonder Woman. They're going to zoom that information of threat, whatever threat it is, to the brain, and the brain, trying to do its best to protect you, protect the body, it sends signals of pain to your body. It sends signals for your muscles to contract, to protect that area. It sends signals of fatigue. It also could send signals of happiness, of safety, of ease of movement. So what happens over time is that there is a faulty patterning of too much protection, an overly sensitive nervous system, scared about anything, or anything like trip, oh, there's a threat, let me send it to the brain, and a overprotective, like a helicopter parent brain that sends immediate signals of pain, which is a protective signal, because when you feel pain, it makes you protect yourself more or makes you want to go visit another physician to figure things out. So Pelvic Sense is designed to reverse this pattern. It's designed to reverse central sensitization. And how does one do that? It's going to teach you, first of all, it's going to educate you about pain. Once you understand that pain does not come from the physical tissue where you're feeling pain, whether it be your pelvic floor, vaginal region, rectal area, it doesn't come from that tissue. It comes from the brain because it wants to protect. So we're going to teach you a little bit about pain neuroscience without getting too heady, because we know you can't handle that. It's going to show you a little bit about what happens in the brain over time when one is in chronic pain. And so you understand, well, why do I feel brain fog? Well, it's because your executive brain, the prefrontal cortex, the one that makes decision, it kind of goes offline. And what goes online is that yelling, loud alarm brain, the amygdala, the midbrain, that is clanging its bells over and over again. And the executive brain, which should say, hey, things are chill, relax, everything's okay, it's not able to do that. So the alarm brain takes over and you're in constant threat, and the brain is sending constant signals of pain. So there are lots of self-care techniques that you can do. It's about you changing patterns, and it's about practicing these patterns over 3 months. That's why Pelvic Sense takes about 3 months for you to see changes, because you're going to start developing new ways of reacting. You'll learn techniques like breathing. What does a breathing do to my nervous system? And you'll find out that breathing activates that rest and digest nervous system, the parasympathetic nervous system, which calms the area, calms your overactive nervous system. You're going to also learn techniques like mind exercise, like being grateful. There's lots of research showing that if you're thinking about once a day 3 things to be grateful for, thinking about positive affirmations, those are some mind exercises. There are many more in the program. And you're also going to learn how to move easily. We're going to start you with very simple movement exercises that's light, that's subtle. We're going to ask you to think about them. We're going to ask you to ask yourself, is this a dangerous, or is this making me feel safe? We're going to guide you on so many beautiful at-home techniques to lower that central sensitization. And after 3 months of you practicing it And you can practice just 15 minutes a day if you find that the whole program takes too much time out of your day. If you do a little bit every single day, understanding, thinking about, learning, listening to the rewire, which are audio guides to calm, and then following through with the move exercises, this is going to change the way that your brain and your nervous systems function, because it has that beautiful ability to change. It's called neuroplasticity. So we're going to really incorporate these skills that you can do, you can practice. So the end result is to have a significant lowering of your pelvic pain or pelvic distress by reversing central sensitization. So I hope I've made some insights on a new technique, a new program that states I can heal, you can heal your pelvic pain in 3 months, to now feel a little trust that this is possible based on science. And as I'm a physical therapist for 25 years, I've seen how many patients have changed and gone to long-lasting healing by doing these techniques that you'll get in Pelvic Sense.